Hey guys, it's Louis here from ndxtesting.com, and in today's video we're going to speak about EMG testing. Now it's important that you understand exactly what the procedure is going to be. That way you don't have to be overly nervous, because I get a lot of comments sometimes in my TikTok videos or on YouTube shorts, and people are overly nervous. So it's important that you understand the process, that way you could be in control, and that's what we're going to try to accomplish in this video. Now, the most important thing that you need to know is that an EMG, it's a nerve and muscle examination, and those are the two key words that you need to remember. Now, the nerve examination is usually done by a registered licensed technologist in the field of electrodiagnostic medicine, and then what he's going to do is that he's going to use electrical impulses on the extremities, arms and legs, and sometimes they'll do either or both, depending on your clinical diagnosis. So when he starts, if it's in the upper extremities, he's going to start at the level of the wrist. He's going to stimulate very, very mild and increase it until there's some sort of motor reflex. So he'll grab some sort of stimulator and he'll stimulate at the wrist, he'll stimulate at the level of the elbow, and he could stimulate at the upper arm. If it's done correctly, if the technician has pinpoint precision of the peripheral nervous system, if he has good communication, that part should not be a problem. Before we get into the muscle part, I want you to understand this, that all the nerves you have from your shoulders to your fingertips originates from the neck. So when the technologist stimulates the nerves at the level of the arms, those nerve roots, he's going to get a lot of information that comes from your neck. So if you have a severe situation on your neck, if the nerves are really, really compromised, they might be affected. They might be affected in the extremities. Now what happens is that once the nerves pass the shoulder, okay, and they cross the elbow, they're very, very superficial. So the technologist could study those connected nerve roots that come from the neck and get a lot of information. And obviously they get key information when it comes to your wrist and to your elbow, when it comes to the entire extremity. If something's going on, then he will know. Same thing when it comes to the lower back. All the nerves you have from your hips to your toes originates from the lower back. So the lower back is like kind of the fuse box of the lower extremity. So when the nerves pass the knee, they become very, very superficial, and technologists could study those connected nerve roots. And the reason I'm saying that is because sometimes you might have just the lower back, right? And you might have lower back pain, and they send you for the EMG, and you're probably wondering, why are you doing my legs for? There's nothing wrong with my legs. Okay, but in order for them to study the nerves that originates from at the lower back, they need to study those connected nerve roots at the legs to see if something's going on. Now, the EMG part now, which is the needle electrode. Now they're going to use a needle electrode for that. Now that electrode is not designed to withdraw blood or insert any sort of medication. Sometimes people panic, or they think they're going to feel electrical impulses with that. You're not going to feel any electrical impulses. Again, they're not going to withdraw blood or insert any sort of medication. The physician, usually the clinicians that do these exams, they specialize in electrodiagnostic. It's either a neurologist or a doctor of physical medicine, which is a physiatrist. Those are the main two. There's some other doctors who are cross-trained when it comes to electromyography, but those are the main two guys. These doctors are going to take a needle electrode. You got a little packet like this. They take out the needle. It has a string, hooks up to the amp, and then the other part, they're going to study your muscles. So now, if you can pinch yourself as hard as you can, that's what the needle electrode is going to feel like. Remember, they're not going to withdraw blood or any sort of medication. So they take it, okay, they'll pinch the muscle, and the objective is to be able to record the electrical activity of your muscle. Now, if it's done in the upper extremities, they're going to do traps muscles here, shoulder muscles, neck, deltoid muscles, maybe some bicep muscles, maybe some triceps, and then in the arm. So when it comes to your most traditional and basic EMG, they're going to do the neck. The neck is not too bad. If he's really good with his hands, nothing to worry about. You're going to feel a little pinch, and he's going to record the activity. Traps, upper extremities is not going to be bad. Lower back and some of the leg muscles is not going to be bad. Now the difference is this, look. So as long as you're able to understand procedure, okay, so as long as you're able to understand these basic electrodiagnostic components, as far as an EMG, which is, it's a nerve and muscle study. The nerve examination, they use electrical impulses, and if the technologist uses electrical impulses with pinpoint precision, uses the exact amount of intensity that your body structure needs, then you're going to be fine. You know, you might be a little sensitive in some cases, but it's not going to be painful. I've done this for 30 years in pain. This is not a painful test. It could be painful if the technologist is very uneducated and uses high intensity. It's your body. You have to tell that technician to start at 0. So you have to be able to communicate that you're going to start with the intensity at 0 and then increase it. I'm guessing that a lot of technologists do it correctly, but then a lot don't, because I've been to many seminars in the past, and they're taught to use high intensity. We're not here to baby patients, and that could be a problem, because there are some patients that are sensitive, and there are some patients that are coming not knowing exactly what they're going to feel, and your job is to make them feel comfortable. With the physician doing the EMG with the needle electrode, if he has good communication, you're going to be fine. The problem is when they can't communicate. Another thing that I want you to know, there's sometimes people ask me if it's okay to take anxiety pills. Now, if you feel nervous about the test, then you have to speak to your physician or speak to your internal medicine doctor, where you can get some medication. And I guess it's okay, but that's a decision that you have to make with your doctor as far as taking anxiety medication, because maybe you feel a little bit nervous. But the situation is this: that I never had a patient that took these pills, maybe in 30 years, once or twice. I can't recall, but even if it's twice or 3 times, that doesn't count as far as patients need to take medication. Now, if they're nervous about the exam, there's sometimes I do get patients very, very nervous, and then what happens is I explain them the procedure, give them a sample of what they're going to feel, and then don't worry about it. We don't have to do anything today. You can come back some other time. This is not ultrasound where you're going to feel just gel. This is an EMG where you're going to feel electrical impulses, and you're going to feel the needle electrode penetrate your skin. So you want to go to a place where they communicate these exams and they explain it to you, the procedure, at the highest level, along with your clinical complaints. Okay, because you have complaints when you need the exams, along with the clinical diagnosis, let's just say, with all the diagnostic findings, whether you're going to have an MRI or you're going to have an MSK. All these things paint a complete picture as far as your body, as far as what's going on. But if they can't explain these things to you, if they can't do a good job at communicating the procedure, then maybe you have to go someplace else. I don't know what would be there's no emergency that you're going to need an EMG. The emergency is to go to the right place. Anyway, with that being said, if you need any help, if you have any questions regarding electrodiagnostics, the nerve examination, the muscle study, just write in the comments below. I'll see you in the next video. Bye-bye.